I'm Kate. I'm a data scientist at Biostat Global Consulting. We provide statistical support for public health research around the world. And I'm talking today about design decisions in a form when you're trying to improve the data quality that you're getting out of a relatively complex data collection task. The examples I'm going to be talking about come from work with the American Red Cross on their 5-point plan to sustainably strengthen childhood immunization. In the 5-point plan, we have Red Cross volunteers who go and collect data in their communities. They go from house to house throughout an entire target district. They're collecting information at every house, where the house is located, who lives there, and doing more in-depth interviews at places that have children that are young about their vaccination status. The data collectors come from the communities where they are collecting data. That has huge benefits for us in terms of taking advantage of their local knowledge, and it also comes with challenges because these people do not necessarily have a lot of experience collecting data, and their experience level, their comfort level with technology like smartphones also varies widely. They have a one-day training where they learn all about the 5-point plan. They have a lot of information to absorb in a very short amount of time. And so it's really important to design the form thoughtfully to make it possible for these people to do their job with very little training and background. Some of the design decisions that we're thinking about have to do with the flow of the questionnaire, the questions and the prompts that these people are encountering. Of course, we're talking about validation, constraints on the values that you can enter. We don't want them to be entering dates of birth that have yet to happen, but also soft constraints, like Ellen was talking about earlier. Some prompts when volunteers entered some information that is possible but not very likely to say, hey, are you really sure that that's the right information that you wanted to enter? When information is particularly critical for us to get right and can be tricky to record correctly, double entry is really important for us. We use this particularly for date of birth. A child's age is really important in our analysis stage for understanding what vaccinations they're eligible for, whether they're eligible to be in our study to begin with. So we have volunteers enter that information twice. We also have them enter ID numbers that link multiple visits to the same household. We have them enter that information twice because we really rely on that information. They take a photo of some of the vaccination records that they encounter. That allows us to calculate some metrics around the accuracy of the data that have been collected. And we take advantage of ODK's last saved values as well to carry forward information in multifamily dwellings, high rises, about the location of the building, the name of the building, things like that, and make sure that's associated with all of those records. Of course, we're always thinking about ways that we can improve. I've been thinking about entities for quite a while, about whether that's a better way to manage things like our longitudinal data collection. And also thinking in the context of improving technology around image processing, whether it makes sense to shift the burden off of the shoulders of the volunteer when it comes to recording vaccination information. Maybe they should be taking pictures of every vaccination record they encounter. There are also some things to think about with respect to how the form is designed. It's surprisingly difficult to click the right thing on your phone screen sometimes. When we have the opportunity, we like to space out answer options more so that people are more accurate in clicking what they're trying to click. When we're working in a new context, there's all sorts of things to consider about how the form needs to be translated, what languages, making sure that the translations are very clear and consistent, and other factors beyond translation, like what are the names and abbreviations of the vaccines that we're interested in? How are those represented in that particular country context? We like to use information that was already entered in a previous question in future questions. So we don't ask what is child one's date of birth, we ask what is Johnny's date of birth. Or if we're prompting the interviewer about something they entered incorrectly, we like to play that information back to them and say, here's what you entered and here's why it's a problem. Go back and fix it. And of course, we like to customize the Collect app interface itself to hide unneeded information from data collectors. Thinking about ways that we can improve this, we haven't run into problems with this yet, but we probably should password protect our settings for the ODK Collect interface. And I've been thinking about using guidance hints for some of those more tricky and context-dependent questions as well. I didn't know about that until quite recently. Okay, two last big picture things. First of all, I love to diagram ODK forms for my own development and debugging and for communicating about forms to other people. I find that super helpful in terms of structuring a form thoughtfully. And then so many of these design decisions come and are informed from insights from the field, from people who have actually used the form for data collection. If you have the opportunity to do field tests and gather lessons learned from people who are actually using the form in the field, that is super valuable. Thank you so much.
Thank you.